Hey everyone! So let's talk about something that's probably bothered you at some point, waking up with swollen, stiff fingers. Or maybe you've noticed your knuckles looking puffy after a long day at work. Finger inflammation is one of those things we tend to ignore until it actually starts affecting our daily life, right? And here's the thing, about 54 million adults in the United States alone deal with some form of arthritis or joint inflammation, according to the CDC, and a significant portion affects the hands and fingers. Today, we're diving into what's actually causing your fingers to swell up, the science behind it, and most importantly, what you can actually do about it. So let's get into it. So first, let's understand what inflammation actually is. When your finger swells up, your body's immune response kicks in. Blood flow increases to the area. White blood cells rush in, and you get that classic combination of redness, warmth, swelling, and pain. It's actually your body trying to protect and heal itself. But sometimes this response goes overboard. One of the most common causes is osteoarthritis. This is the wear and tear arthritis that happens when cartilage in your joints breaks down over time. A study in Arthritis and Rheumatology found that hand osteoarthritis affects approximately 16% of the population over 18 years old, and that number jumps significantly as we age. The protective cushioning between your finger joints wears away, bones start rubbing together, and your body responds with inflammation. You'll typically see this affecting the joints closest to your fingertips and the base of your thumb. Rheumatoid arthritis is different. It's an autoimmune condition where your immune system mistakenly attacks your own joint lining. Research from the American College of Rheumatology shows that about 1.3 million Americans have rheumatoid arthritis, and it prefers the small joints of the hands and fingers. Unlike osteoarthritis, which usually hits one side more than the other, rheumatoid arthritis tends to affect both hands symmetrically. Let's talk about something that's become incredibly common in our digital age: trigger finger. If you've ever had your finger lock up in a bent position and then snap straight, that's trigger finger. A study in the Journal of Hand Surgery found that the lifetime risk is about 2 to 3% in the general population, but it jumps to 10% in people with diabetes. The tendon sheath in your finger becomes inflamed and narrowed, making it difficult for the tendon to glide smoothly. This is super common in people who do repetitive gripping motions. If you work with your hands a lot, you might be dealing with tendinitis. This is inflammation of the tendons in your fingers from overuse. According to research in the British Journal of Sports Medicine, overuse injuries account for about 30 to 50% of all sports-related injuries, and the hands are particularly vulnerable. Your tendons get micro tears from repetitive movements, and if you don't give them time to recover, you end up in a chronic inflammatory state. Here's one that might surprise you: infections. Paronychia, an infection of the skin around your fingernails, is incredibly common. A study in American Family Physician noted that acute paronychia is one of the most common hand infections seen in primary care. This usually happens when bacteria get in through a break in the skin from nail biting, aggressive manicuring, or a hangnail. Gout is another culprit people don't always think about. We usually associate gout with the big toe, but research in Arthritis Care and Research shows that gout can affect the fingers in about 10% of cases. Uric acid crystals deposit in your joints, and your immune system sees these as foreign invaders, launching an inflammatory attack. The pain can be excruciating. If you're finding this helpful, please give this video a like. It really helps get this content to more people who might be dealing with finger inflammation. So now that we understand what's causing inflammation, let's talk about what you can actually do about it. The treatment depends on the underlying cause, but there are universal strategies that work across the board. First up, the RICE method: rest, ice, compression, and elevation. A systematic review in the Journal of Athletic Training confirmed that ice therapy significantly reduces inflammation and pain in acute injuries. When you ice your inflamed finger, you're constricting blood vessels and reducing the inflammatory response. Aim for 15 to 20 minutes at a time, several times a day. NSAIDs like ibuprofen or naproxen are often the first line of treatment. A meta-analysis in The Lancet found that NSAIDs are effective at reducing both pain and inflammation in arthritis patients. These medications block enzymes that produce prostaglandins, chemical messengers that promote inflammation. Just be aware that long-term use can have side effects. For chronic conditions like rheumatoid arthritis, disease-modifying drugs might be necessary. Research in the New England Journal of Medicine has shown that early treatment can prevent joint damage and preserve functions. Physical therapy and hand exercises are crucial for maintaining mobility. A randomized controlled trial in the Annals of the Rheumatic Diseases found that hand exercises significantly improved function and reduced pain in people with hand osteoarthritis. Simple exercises like making a fist, spreading your fingers wide, or using therapy putty can make a real difference. Splinting is effective, especially for trigger finger and tendinitis. A study in the Journal of Hand Therapy showed that nighttime splinting was effective in treating trigger finger in about 87% of mild to moderate cases. The splint keeps your finger straight while you sleep, preventing that painful locking sensation. For infections like Paronychia, you'll likely need antibiotics. For gout, treatment focuses on lowering uric acid levels. Medications like allopurinol reduce uric acid production, and studies in JAMA have shown that maintaining proper levels can prevent gout flares. Dietary changes also help. Limiting foods high in purines like red meat, shellfish, and alcohol can reduce gout attacks. Lifestyle and prevention. Beyond medical treatments, lifestyle modifications make a huge difference. Maintaining a healthy weight reduces stress on your joints. Research found that even a 5% weight loss can significantly improve arthritis symptoms. Omega-3 fatty acids have anti-inflammatory properties. A meta-analysis showed that omega-3 supplementation reduced joint pain and stiffness in rheumatoid arthritis patients. Adding fatty fish to your diet a couple of times a week can be beneficial. Ergonomics matter too. If your inflammation is related to repetitive strain, taking regular breaks and adjusting your workspace can prevent further damage. Studies show that taking a 5-minute break every hour can reduce overuse injuries by up to 30%. When to see a doctor? Here's when you absolutely need to see a doctor. If your finger inflammation is accompanied by fever, if the swelling is severe and sudden, if you can't move your finger at all, or if the inflammation isn't improving after a week of home treatment, these could be signs of a serious infection or systemic disease. So there you have it, a comprehensive look at finger inflammation, from the common causes, backed by medical research, to the treatments that actually work. The key takeaway is this inflammation is your body's signal that something needs attention. Don't ignore it, but also don't panic. Most cases can be managed effectively with the right approach. Remember, early intervention is crucial. The sooner you address finger inflammation, the better your outcomes will be. If you found this video helpful, please hit that subscribe button and turn on notifications so you don't miss future content. Drop a comment below if you have questions or want to share your own experiences with finger inflammation. Thanks for watching, and take care of those hands.